You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says that nobody should be wearing a loose-fitting denture. We're talking about dental implants today, the newest, hottest trend in dentistry, and also we have Montana's busiest implant dentist, Dr. Matt Larsen. Dr. Larsen, welcome to the program. Welcome back, I should say.
Well, thank you. It's good to be back.
Now, we had you on here 4 years ago, and what's changed? What's new?
Well, how long we got? Like, I mean, everything's changed. It changes so fast. The technology that we use to place the implants has changed. Everything's gone to guided implant placement now.
All computerized.
Yeah, computerized. The CT scans, we integrate them with the models in someone's mouth. We're printing these guides that allow us to do precision surgery. We can put implants in places that we couldn't do 4 years ago. It's really cool. Some of the new techniques for bone grafting and some of the stuff that's coming out. It's changing every month.
You said it, like, even in just the last 12 months. I mean, what used to take you a few months now, literally, if somebody's watching this, and if everything works out, somebody in their 70s watching this, if you had availability, correct me if I'm wrong, the day after tomorrow, they could have upper and lower teeth that don't come out.
They could.
Okay.
And
you could do this in like 2 visits, 3 visits.
That's very unique to us. Okay, we actually have a lab in-house. We have a lab upstairs. We were just starting with that when I was last here.
This big monster lab, big, right?
Yeah, it's pretty big. But with our lab upstairs, we can literally turn it around. We could have somebody in and we could take scans in their mouth. We mostly do scans now. We used to take impressions, fill up the trays.
What does this mean, scans as opposed to the old way?
We take an intraoral scanner and we do a digital scan and it generates a 3-dimensional model of the inside of somebody's mouth.
The goop they used to put in is gone.
Yeah, we don't use that very much anymore. Now we do the scans and all that gets electronically transmitted. It used to be to another lab, but all goes upstairs. The lab's just right upstairs from where we do the surgeries. It all gets sent upstairs. They can literally design, mill, and have us teeth ready to go within 2 days sometimes. We've had patients walk in the first part of a week, and we've done a surgery the end of the week, which is unheard of.
So they get their new teeth.
Yeah.
By that.
Yeah.
So this could be like 3 visits.
Yeah. Oh, yeah.
Like they meet you the first one, the second one you get all the imaging,
collect
X-rays,
all the information.
Whatever.
Yeah.
And then you do
the surgery. Yep. And at the time of the surgery, we put new teeth in. We have people that walk in dentures that day and walk out with teeth that are screwed in, and they can't believe it. And even that night after surgery, people can eat better than they ever ate with dentures, with those even provisional teeth that we've got screwed in and fixed in their mouth. So
because of your lab, that means where you make the teeth, mill the teeth, print the teeth right there.
Correct.
Is that why you're able to do it so fast?
Yes.
And also, how does that affect expense? Were you able to drive down your cost a little bit?
Yeah, we actually are able to control costs because originally we would take all those models, we would take all those scans, and now we're going to send them out. A lot of times we'd have to mail them out of state to get this type of stuff done. So just imagine to yourself the shipping times. It's the shipping times.
That's how it's being done across the country, right?
Right.
You ship it out to a lab, you wait.
Correct.
But could you ever go back to that way? Is that old-fashioned to you?
Well, it's old-fashioned to me because of the way I do it now. And so for me, if I have problems, I can literally take somebody's case and I can walk it upstairs.
Now, I asked you at the beginning, what else has changed? I mean, what's changed? What else has changed? Other than you could do it faster, less downtime, better-looking smiles, all digital. What else?
Our surgeries are faster. The amount of time that a patient's in the chair under sedation, it's quicker. Because we can now be so accurate with our guides, we're not spending a lot of time, trying to make sure implants are the right angle. We have that all planned out ahead of time.
Okay.
So digitally, that all happens behind the scenes. So when the patient comes in the day of surgery, their surgery, we've already done all the work. We've spent, between the lab and us, we've probably spent 10 hours working on this case, getting everything perfect, so that when the patient's in the chair, it's a faster appointment.
Good.
It's minimal invasive dentistry.
And these are sedation patients, right?
Yeah.
I mean, everybody's sedated and numb.
Yeah, most of them are sedated. We have an occasional patient that just doesn't want to be sedated.
But they're numbed up.
Yes, they're all numb. They're comfortable. Let's say that. All of them are comfortable. And whatever level of comfort they desire, we will give them. You know, you asked the question, what else is new? What else has changed in the last 4 years? One of the biggest things that's changed is my appreciation for what happens in people's lives when we give them teeth. When we did this 4 years ago, I'd done, maybe 20 or 30 cases. And so I had kind of this limited exposure. Since then, we've done
like hundreds
of cases. And what I have found is that I spent almost 20 years as a dentist doing fillings, doing crowns on people. And people would come in and I'd do a filling, or they'd break a tooth and I'd do a crown, and they'd go home and guess what? That night their tooth was a little bit sore. They didn't really know what I did. They didn't really have a big change in their life. They just knew that it kind of hurt, and they gave me some money, and you just never got a lot of emotional gratification from that. But with these type of cases, I mean, people come in, and as we watch them over the course of the surgery,
like they want to give you gifts, you said, or hug you.
We've got so many muffins and cookies. I'm gaining weight because people are they like bringing us food for some reason. We just had a guy bring us these cupcakes with cute little tooth, like these little fancy cupcakes. You've seen them where they build up and they put a little tooth on them. People love it.
But they all have regrets, you say. A big regret.
They all have regrets, and their main regret is once they've done it and they see how they look and they see the change it makes in their lives, they always think, why didn't I do this sooner?
Do you really hear that a lot?
Oh yeah, all the time. Almost everybody, we hear that, and they just wish that they hadn't put it off.
Now you have patients, we were talking in the green room, that they watch the show, they watch your interview with me. They watch it, they tape it, they DVR it, they force their poor family to watch it, and they still come in skeptical.
Yes, all the time. But I love it when they do that, because when they've watched the show that much, it gives me a sense of what's going on in their life. If somebody's willing to watch me on TV, that many times, there's got to be something behind it. There's got to be some pain there. There's got to be some problems that they're having. They're having trouble eating.
But they wait too long. You say people wait too long to do anything.
Absolutely. If you're having trouble, if you can't chew, if you've got teeth that hurt, if you're wearing a denture, please, now's the time. If you watch this show 10 times and then come in, all the time it took you to watch that show 10 times, or to have that impression on you those 10 times, really, you could have been enjoying a great smile. You could have been enjoying a boost of confidence.
What do they like eating? Like, what do you hear? Like in Montana,
steak.
What do they want?
It's always steak. Yeah, we put those teeth in, and people are always like, I'm going to have a steak. I haven't had a steak in years.
People with bad teeth, you've told me, salads in particular, very tough to eat.
Yeah, they have a hard time chewing them up. If you don't have a lot of teeth that line up, and you don't have really good occlusion, you're just going to push salad around. And usually they can't chew it up enough. People just stay away from it. They stay away from salads. They stay away from a lot of foods that we know make us healthy, because they just can't chew them up enough to be able to swallow them, especially in public. In public, they're going to go into a restaurant. They are not ordering a salad. They're going to order something, the mac and cheese, something that they know they're going to be able to eat without being embarrassed. And so, like, I would say to somebody, if you're going to the restaurant and you're looking at the menu for what you can eat and not for what you want to eat, you got to come talk to me, because that's no way to live. Nobody should live like that.
The chewing, the eating, or do they like the way it looks? Or is it a combination of both?
They always come in and say they want to be able to chew. And it's kind of funny, because we get these rancher guys, or these tough, guys working out on the railroad, stuff like that. And they'll come in, I just want to be able to chew. I want to be able to eat a steak. And as we get into it, these are the guys that when we start doing the cosmetic part, these all of a sudden are the most picky guys. They want to have this little sparkle. They want them a little bit lighter. Can we do this and do that? And then they fall in love with the way that
now they're smiling all over town.
Oh yeah. And not only that, but like, we see it. It's so great for us, because they come back in for a cleaning, and for years we'd been seeing them, and they come in and just mope around in the office, and and they and they talk to her, and all of a sudden they're coming back and they're like smiling and talking, and they're flirting with the receptionist. It's like they're a totally different person. And so, like, it's if I could just somehow share with people how much of a difference it could make in their life.
Okay, are there still a lot of denture wearers in Montana?
There are tons of denture wearers in
People
Montana.
that are
Yes.
going to end up in dentures?
Yes. People go into dentures every day in Montana.
So don't do it.
Don't do it.
Like try to get them attached to implants.
Yes. Don't go to dentures. Dentures, you got these big old plastic things in your mouth that are moving around, and you're trying to chew on, you got like moving targets in there. People just struggle with it. And I did dentures for a long time. I don't do them anymore.
Then what do you say to the people that you fit for dentures in Montana? What do you say to them right now?
I'm sorry. Come see me, because we got options now. We got so many more options.
Good.
And I've made a lot of dentures for people. And you know what? I've remade a lot of dentures for people. And I see a lot of my denture patients, and they still struggle. They still have the same struggles they did when we remade the denture the last time. There's only so much you can do to make
Yeah, but if you're on a tight budget, I mean, sometimes all you can get is a denture, right?
Correct. If you're on a tight budget, you got to come talk to us. There's a lot of different options. One option is we do great financing. We got this gal.
You told me on the couch that
Carrie.
She's
She's awesome. And you know what? She was my assistant for a couple years, and she knows the stuff. Like when you come in and she's looking at your teeth and looking at your x-rays, she understands that. She's worked with me long enough that she knows what's going on in your mouth. And she'll take the time to sit and listen to you, and she knows what's gonna work, and she knows what's not gonna work. And she is able to utilize some different financing options to get you. I mean, we have people that come in and they get their mouth done and they end up paying $300 a month. You know, I mean, how much
less than that, you were telling me.
Yeah,
in many cases.
You know, it depends on the procedure that's done, but you can get financing and make it very affordable.
Okay, good.
I would say that the majority of the patients that come into my office, they don't just pull out a wad of cash and pay for it.
They're financing.
Most people finance it.
That's good to hear.
It's very similar to...
Because dental insurance, Medicare, Medicaid doesn't really cover this at all.
No.
Right?
No. But dental insurance, none of those really... They all have a maximum allowable that doesn't really...
Which could be like $1,000, $500, something like that.
And then they won't pay anything after that.
Okay.
And a lot of the procedures, implants, stuff like that, some of them don't even pay on that.
Okay.
Which I think is...
So now financing. That's the way to go. Let's take a look at some of the photos.
Okay. So the first guy here, I'm gonna give you his before. This is a guy that he got divorced and hadn't been dating, hadn't really been comfortable going out in public, smiling, eating, doing anything. His teeth, as you can see, they were just kind of hanging out there. And when you get to this point, people sometimes they don't realize how low the quality of life they have is, because every time he would go to eat, his teeth would move. So he had like 2 spots in his mouth that he could put food to chew.
So you really can't, like when you have teeth like this, you really can't eat like a chewy pizza or almonds.
And you can't bite anything off because there's pain and the teeth are moving around on you. But he'd been doing this for years. This is a guy, he should have come to see me a long time ago. You know, we could have saved him
So what did you do for him?
A lot of pain. So on this guy, he has implant.
So his option would have been a denture.
A denture, absolutely. We couldn't save his teeth.
Okay.
There was zero chance to save his teeth. So on this guy, he couldn't eat. He had periodontal disease, his gums were infected, his teeth were moving around, he had a lot of pain. We took the teeth out, we cleaned everything up, we got all the infection out of there.
Okay.
We got the gums healthy, we gave ourselves a really good foundation in there, and we did dental implants and gave him permanent teeth. He has teeth that don't move around on him.
Looking good.
And he can eat whatever he wants. And this guy changed his life. Just to talk to him, he was a totally different person. He was happy, he was friendly, he'd talk, and he would show his teeth as he talked. He would never show teeth, he would never smile before. And all of a sudden, he is one of the friendliest guys. Come in the office, talk to everybody, smile at everybody.
So they return to who they used to be? Is that your take on this?
You know,
like if you're outgoing?
I didn't know who he was before, but in my opinion, yes. He all of a sudden had, you know, he looked younger, and I feel like he acted younger. So in my opinion, I think he probably felt younger. When he looked at himself and when he talked to people, when he smiled and he got that reflection from other people, you know, that when he had this nice smile, I feel like it made him feel younger. It made him more outgoing. Yeah, I'm sure it took him back to
he looks more handsome.
who he used to
That's
do.
for sure.
He is a handsome guy. Yeah, great guy. A great smile makes everybody look better.
Okay.
You can't argue with that. You look at the movies. They want to make somebody look
bad.
Yeah, they want to make somebody look less intelligent, or they want to make somebody look poor. What do? They give them bad teeth. They discolor their teeth. And it's not that people aren't taking care of their teeth. It's not that he wasn't trying to take care of his teeth. He was brushing them all the time. He was using mouth rinse. He was doing his best. But in his situation, there was nothing he could do.
So
he was going to lose his teeth.
It's a bacterial infection.
Yeah,
you can't brush and floss it out.
And it spreads around to all the teeth. And the more bone loss he gets, the more prevalent that infection gets. And then he actually gets where he gets stuff draining out around his teeth because they're so loose. At that point, there's nothing you can do. He's fighting bad genetics more than he's fighting poor health care.
So now he can eat whatever he
oral
wants.
care. Yeah. Oh yeah. And he does. Yeah.
What about things like beef jerky?
Oh yeah.
Really? So it doesn't matter.
I know. Beef jerky, raw broccoli, raw carrots. This is stuff that
they could even eat things they're not supposed to eat, like ice cubes, like that, right?
No.
Dennis, you don't allow people to have ice cubes, right?
No ice cubes.
Or opening cans or bottles.
None of that.
They're not allowed to do that.
They're not allowed to do that.
Okay, we're going to take a quick break. We come back, more photos, more about the dental implant process. According to my first guest, no more dentures. We'll be right back.
I really believe that no one should be wearing a denture. Forget about loose dentures or floppy dentures. No dentures.
There was some foods, like corn on the cob. I couldn't eat that anymore.
He came in with a lot of missing teeth, loose teeth. We did implants, and he has fixed teeth now. He can't take them out if he wants to. They're just like his natural teeth, only he's got more of them, and they're all straight and beautiful, while he can eat anything he wants to eat now.
I'm Randy Alvarez. You're watching the Wellness Hour, news that makes you healthier. With us, we're talking about no more dentures or getting a brand new set of teeth supported by dental implants. With us, we have Dr. Matt Larsen. Okay, now I said you're one of the busiest guys in Montana. Look, my program, and we've had it for 24, 25 years. You were telling me some of the new patient numbers you have. You're one of the busiest guys in the country.
We do a lot of implant dentistry. We do a lot of these full mouth restorations. So
they're never too far gone.
No.
How old can you be to do this?
The oldest person we've done one on was 93. And
why would a 93-year-old want to do this?
The reason they want to do it is they just want to be able to function. They want to be able to be comfortable with their smile. They want to be able to eat. And, as we get older, our bodies get a little bit older, but our minds are always, I think about myself, and when I'll see myself on TV, it's always a little disheartening because in my mind I'm trim and fit and this healthy athletic guy. and I think that as we age, our minds we still want to enjoy things. And as we age, more of our life starts to revolve around eating and food and talking to people. And if you go to any event, what are you going to find there? You're going to find food. And if you can't eat in front of other people, it really limits the type of activities and the social interactions that you can have with other people.
So somebody watching this, let's say it's a Monday. They could have their upper and lower brand new set of teeth on Friday if you have appointments available.
if we have appointments available, right? Yes.
That's true.
Yes,
does that happen? Could. And that does happen.
Yeah, that does happen. We have people come in and for whatever reason they've just made up their mind. And they're just tired. They're in pain. They're tired of being in pain. They don't want me just to pull a tooth. They just want it done.
Okay, good. Let's go to the next photo. That looks pretty dramatic.
All right.
This one coming up. I'm not trying to side with you, but this is a good one.
This is very dramatic.
This has got to be unusual. I mean, those teeth are looking pretty bad.
It's not that unusual. You probably never see it because these people, they don't smile. She would never smile at you. We would talk to her. We had to force her to smile and be able to show us her teeth. You would have never seen her teeth out in public. She gets teeth like this, they get loose. So somebody like this, the only option she has, she's gonna lose her teeth. And she knows it. And she's known it for a while.
Bad time eating?
Yeah, she could hardly eat. And it got bad enough that there was pain whenever she would eat. She didn't want dentures. She thought that was her only option. When she came to us, for her to know that she had another option, that she could do something besides dentures, this was a pretty emotional one for all of us. You can see how her teeth looked. And when you saw this woman on the street, you would never think that. She was a professional. She dealt with the public.
Just didn't smile.
She dressed very nicely. You would have thought that if she had smiled, she would have had a perfect smile. She did a lot of business with the public. You would never guess, but you would never see it because she'd never show you. And when we saw that, when she came in and we saw what her teeth looked like, for me, I just said, we can help.
Do you get
We can
excited like
fix
secretly
this.
sometimes?
I
Like, go,
get-
wow, this is going to
Not
be good.
secretly. I get excited in front of them.
Okay,
And I tell
okay.
her, I say, listen, you've got options here. There's something we can do. And this lady said one of the things that motivated her to come in and see us is she said, I'm a very confident woman and I try not to smile and I'm very professional. But she said, I could always tell when people saw my teeth. I'd be talking to somebody and all of a sudden their face would just, she said, I knew it. And I knew they had seen my teeth and their face would just fall and they became very uncomfortable. And she said, I was still me trying to talk to them, but it changed the conversation because all of a sudden they were uncomfortable around me. And she said, I'm really having a hard time with this.
Wow.
I really need help with this. And so we said, we can fix that. And we were so excited because the difference we can make with something like this, unbelievable.
Okay,
That's her final.
This is
Amazing.
It is a big difference.
She became one of our biggest fans. She came in, she did commercials for us, a couple of different commercials. She would tell everyone about it. And look at her. I mean, look at that. Why wouldn't you? All of a sudden she can smile. Now she can smile
It's
and
like
talk
her
with her teeth.
identity has changed.
Yes. Oh.
Because she looks like a totally different person.
Yeah, her whole personality. And she looks like a happier person. It makes her look younger. It makes her look more beautiful. I think when somebody has a good
you
smile.
guys are exaggerating when you talk about how a smile, but it's true. She does look she looks more refined. She
Yes.
looks happier, more attractive. I mean, it really, and now she could also eat whatever.
She could eat whatever. But when you get to the end of this and you're talking to people after and they start describing to you the difference in their life, and all the time we get people say, you know what? I found that person I used to be. This is who I used to
Good.
be. I found that energy and that love for myself and that confidence. I haven't had that in a long time. And you know what they say? I didn't even realize how much I had lost because of my teeth and how much of my life I gave up because of my teeth. Don't do it. I know we've talked about this, but there's people out there that are watching this show that are struggling with that all the time. Thousands of them.
Nobody likes going to the dentist. Is that what it is? Because they're going, I'd like to do it, but I just can't bring
know.
myself to come in.
But I'm a really nice guy. I know I'm still a dentist. We
But
try
you
to
do
make
love
it,
this. I mean, I should let
do
people
love
know.
it.
Behind the scenes, it's like, this is your thing. I mean,
I
you're
love
into it.
I'm very passionate about it. And if people will come in, we won't make you sit in a dental chair. You could just come in. We're going to sit in an office. We're going to take a scan that shows us all your teeth. It's something you have to stand in a machine. It circles around your head. Boom, done. You come sit down. And I'm going to come in and we're going to go through it.
Good.
And we're going to tell you, hey, this is what you can do. This is what you need to fix. And you know what? Sometimes people come in and they think, oh, my teeth are horrible. It's the end of the world. I need all my teeth pulled. They don't.
Some people you can save their teeth.
Some people come in and we're just like, you need a couple of crowns and we need to fix, you got 3 front teeth that need to be fixed, and boom, they're done.
So they show up and they say, I saw the show, remove my teeth, give me new teeth. And you have to slow them down and say, no, we got to save some of these teeth.
Yeah,
Good for you. Okay.
we hit the brakes. But a lot of times people know. They know. They know if people are complaining about, their breath and odors and, they're afraid to smile. And that reaction, like I loved how she said that. It made people uncomfortable that I interacted with. And if that's happening, come see us. You don't have to live like that. We can fix all that.
We're out of time. Maybe about a minute left. So if you have a couple of photos, we'll rush through those.
Well, I got so much, Randy. This guy, awesome guy, best personality, rancher, okay? Losing his teeth, going to dentures. He didn't want to spend a lot of money. And he came in and he said, you know what, I'm not paying for implants, I'm doing dentures. You can put a couple implants under them and I'll snap them on. Great, we did it. He went away, we didn't hear from him for a while. His wife called us and said, hey, we spent all this money, he doesn't wear his teeth. They sit on the counter all the time. He's out working right now and I can see his teeth sitting right here. What do? Well, we talked about the fixed teeth. He's got to do fixed teeth. He works with his hands.
That just
He's
means
out.
teeth that don't come out.
Yeah, he's got to
Okay.
have teeth that don't come out.
So
That
he
feel
did?
like real teeth. Bring him back in. He came back in. We did it. He loved it. Now he has a great smile. He had a great personality already, but great smile to go with it.
Very nice.
All right, this one, she's a nurse at a long-term care facility, and she's been struggling with these teeth, had a lot of pain, had a lot of broken down teeth. She comes to see us. She's not dating. She's not smiling. She is kind of being a recluse.
Like self-conscious about her teeth.
Yes.
Okay.
She says, I want my life back. What can you do? Oh, and for me, you can imagine, all of a sudden, a big smile comes. I was like, there's so much we can do. And so we started planning up her case. We went through the whole thing. The final result with her, after we put her teeth in, she made it like a day, and she blew up Facebook. She was posting pictures of herself, her new teeth, talking about it to everybody. Amazing.
Well, that's a pretty smile, by the way.
We got more cupcakes. I probably gained 5 pounds because of the cookies and the cupcakes. She is an amazing person. Totally changed her personality.
She literally would have been in a denture.
Yes. She would
So
have
now
had.
these could last as long as she lasts, like
Yes,
into her
yeah.
80s, 90s.
Yeah,
It doesn't matter.
We hope that she'll have these for her whole life. Maybe something happens to them and we have to fix something on
But
them.
they're like regular teeth.
But yeah.
As long as you maintain them,
She'll
they should
brush
last.
them, she'll floss them. They don't come
Okay.
in and out. Gargle with some rinse, a little water pick.
And this was all done in your in-house lab.
Yes.
Right there on the
yeah,
spot.
all of it. We sent nothing
That's a
out
big
for this
deal.
whole case.
That's very nice.
It is a big deal. And for me, to go from being the guy that did fillings and crowns to having people come in and bringing me cookies and telling me how much of a difference it's made and how they found themselves again.
So if they want to make an appointment, do they go online, make the appointment, or do you prefer they call?
We'd rather they call.
Okay.
And we can just set up a time where they come in. That would be my plea to people.
So your final message, somebody watching this, they're the
Final
two
message.
groups. Bad teeth, they currently have teeth, they're bad, or the denture wear. They've heard what you have to say. They've maybe even seen you on TV before, but they're still afraid. What do you say?
Call us. Come in. We'll sit down. We'll talk. We'll have a conversation about what your options are. And I'll let you know what you can do. No pressure. You decide what you want to do. I will give you the information. You decide what you want to do. But let me show you what a difference we can make. Let me show you how different your life could be. Just give me a chance to have that conversation. And that's all I ask.
Dr. Larsen, I want to thank you for coming on the show. Good stuff. Great stuff, as a matter of fact. Thanks.
Thank you.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.